What are the possible causes of high MPV and how is it treated?
Hello everyone. Today we're going to delve into a critical aspect of your blood tests, specifically concerning mean platelet volume, commonly known as MPV. This little-known parameter can provide significant insights into your health. We'll be discussing what causes high MPV and how it's treated. Remember, understanding your blood test results is an integral part of managing your health.
What is mean platelet volume, MPV?
Firstly, let's talk about what MPV is. MPV is a measurement of the average size of your platelets, which are blood cells that help your body form clots to stop bleeding. It is often part of a routine complete blood count, CBC, test. If your platelets are larger than average, it may indicate that your body is producing and releasing them rapidly into your bloodstream, which can be a sign of a variety of health conditions. So, when we say high MPV, we mean that the average size of platelets is larger than normal.
What are the possible causes of high MPV?
Moving on to the causes, a high MPV can be associated with several health conditions. Here are some of the most common ones. 1. Inflammatory conditions. Conditions such as rheumatoid arthritis, inflammatory bowel disease, and some autoimmune diseases can cause a high MPV. This happens because these diseases often trigger an increased production of platelets. 2. Cardiovascular diseases. High MPV has been linked to increased risks of heart attacks and strokes. 3. Cancer. Certain types of cancers, like lung and ovarian cancer, can cause an increase in MPV. 4. Bone marrow disorders. These can result in higher MPV values because the bone marrow is responsible for platelet production. 5. Diabetes. Patients with diabetes often have a higher MPV. It's important to remember that a high MPV isn't a diagnosis but a potential sign of these and other conditions. A health professional will usually interpret MPV in conjunction with other test results.
How is high MPV treated?
Let's move on to treatment options. The treatment of high MPV largely depends on addressing the underlying cause. If a particular disease is causing a high MPV, treating that disease should help normalize your MPV. For example, 1. If the high MPV is due to inflammation from an autoimmune condition, medications to reduce inflammation and control the immune response may be used. 2. Cardiovascular conditions may be managed with medications, lifestyle changes, or in some cases, surgical procedures. 3. If it's a result of cancer, appropriate oncology treatment, such as chemotherapy or radiation, may be necessary. 4. In case of diabetes, proper blood sugar control can help to normalize MPV. Remember, only a qualified healthcare professional can diagnose and manage these conditions appropriately. It's always important to discuss your results and concerns with your healthcare provider. In conclusion, high MPV is not a disease in itself but can be an indicator of underlying health issues. If you have a high MPV, it's essential to consult with your healthcare provider to determine the cause and appropriate treatment. We hope that this video has given you a better understanding of what high MPV means and how it's managed. Stay informed and take care of your health.